My name is Joanna Laurson-Doube. I'm an international consultant and I work with MS International Federation. My focus is on access to treatment. It's a real pleasure to be here at MENACTRIMS, and I'll be sharing some of the global work that we have been doing. So first of all, you might be aware that MSIF has 5 strategic aims. The work that I'm going to talk to you about today is mainly under improved access to treatment and healthcare, but I do want to mention that it overlaps with quite a few of the different strategic aims, such as the confident and informed decision-making, as well as the stronger, broader MSIF movement, which is the capacity building work that we're doing. And before we start, I really want to emphasize 2 things. First of all, any of the global work isn't done in isolation. We really need the national insight to guide us to what we need to be doing and how we need to do it. And of course, it works both ways. So once we have some global projects and outcomes, we want to make sure that it is useful for national advocacy and other efforts. And the other aspect is really about strengthening work between healthcare professionals and national MS organizations, as well as people with MS. And that's why it's so great to be here at MENACTRIMS to talk about the work that we're doing. I'm going to be covering 4 different topics today. In fact, I'll talk about the first 3, and then we will have Dr. Viswanathan, who will be talking about the off-label treatment work that is part of MSIF's projects. First of all, we're going to go through the World Health Organization Global Action Plan and how MSIF has been involved so far. We're then going to be discussing MSIF Atlas of MS, which is a large survey sent to different countries. It will look at both epidemiology as well as clinical management. And then we have one of our key projects, which is around essential medicines in MS. So first of all, in terms of the Global Action Plan, this is an initiative by the World Health Organization, and it really came from the idea that in the past, WHO has often taken a disease-specific approach. There was a Global Action Plan planned for epilepsy, and the idea was that instead of going and just looking at one disease at a time, to take a more holistic approach and actually consider neurology as a whole. The idea is to give some guidance for the different member states around what should be done in neurology. There was a discussion paper back in April 2021, and MSIF provided some feedback on this. And then in July 2021, there was a draft action plan. For this, MSIF had a consultation with our medical and scientific board and also our member organizations. In addition, the WHO has been consulting with people with MS. So MSIF has been helping them find the right connections in order to get people with MS involved in the work. This is part of their initiative to make sure that people affected by the neurological conditions are part of drafting this plan. So you've all heard about WHO, but what do they actually do? So in terms of the sort of different disease areas, what they actually do is that they develop strategies and plans and set targets and monitor progress. And this is with the member states. So the member states would be all the different countries that are involved and their ministries of health. They also train healthcare professionals, and they produce and disseminate policies and guidelines. So the Global Action Plan, or GAP, actually has 5 strategic objectives. The first one is really about raising the prioritization and strengthening the governance of neurological disorders to give them more focus. The second one is about providing diagnosis, treatment, and care, which is timely and responsive. And the third one is about preventing neurological disorders. Fourth one is around research and innovation, and also data collection, such as registries. And the fifth one is really, as I mentioned before, thinking about epilepsy as a starting point to promote the synergies with other neurological disorders as well. So all of the feedback that MSIF has provided on the WHO work is available publicly, but I just wanted to highlight some of the key things that we noted in the draft action plan. This was in consultation with our medical and scientific board, as well as our member organizations, so different national MS organizations. One of the key things was that we really wanted there to be more emphasis on how they were planning to measure and monitor progress towards the global targets. It's great to have a big, ambitious plan, but it's also really important that it is implemented appropriately. The other topic was around how to involve people affected by neurological disorders. So this should be done in terms of the global action plan, but also within the national setting, and how to do this effectively as well as equitably. In terms of improving access to treatment, we actually went into quite a lot of specifics. First of all, what we found was that it would be really important to have a more coordinated approach. So we would really have WHO departments and member states, non-governmental organizations, and the private sector to make treatments available and affordable. There should be real focus of trying to actually solve the problem. The other thing we actually had noted as well was that the private sector didn't have specific actions within the global action plan. And we thought it would be very important, especially around improving access to treatment, because cost and affordability has been highlighted as a major barrier. We'll talk a little bit more about essential medicines for neurological conditions later on, or specifically MS, but I did want to add that we also really emphasized that the WHO essential medicine list should be updated in terms of which neurological treatments are highlighted to be essential for the different ministries of health. And this was one of the key highlights as well that we wanted to push forward. We also wanted more emphasis on actions to support access to rehabilitation. And lastly, looking at neurological data collection, storing and sharing, so registries and other data depositories. So the second topic that I wanted to cover today was the Atlas of MS. So this is a large survey that we send around the world to all the different countries. We have a country coordinator who will collect data on two different topics. One is around epidemiology, so the number of people with MS, and the second one is around clinical management of MS. So first of all, some highlights from the epidemiology report. It has been provided as a scientific publication, as you can see here in MSJ, but it's also in a more sort of user-friendly format as a report on our website. The key highlights, and you might have seen this before already, 2.8 million people are living with MS. This is the latest update, and the prevalence is rising. 1 in 3,000 people with MS, but the prevalence actually changes in different countries, and it can be as high as 1 in 300. The mean age of diagnosis is 32 years, and women are twice as likely as men to live with MS. And we shouldn't forget about pediatric MS. We have 30,000 people who are under 18 who are living with MS. Every 5 minutes, someone is diagnosed with MS. In terms of the clinical management module, we have 4 different areas. We have the diagnosis, we have DMTs. I'm going to talk a little bit more in depth about the DMT aspect later on, and rehabilitation, symptom management, and the wider healthcare system. All of these key findings are found again in a user-friendly report on our website. And you can see we also have nice infographics that you can use to highlight some of these points. They're all free and downloadable on our website. So a little bit more about DMTs. As you can see here in the nice infographic, 7 in 10 countries report barriers to accessing DMTs. The reason is often the cost to the government, the healthcare system, or insurance provider. And what we really noticed was that when we started looking more in depth, we needed to split DMT access into 2 buckets. One was around licensed DMTs. So these are drugs that are specifically have a regulatory approval and indication for MS. The other is something we call off-label. And these are drugs that have regulatory approval, but for a different disease area. But they're often used to also treat MS. And it's clear that there is an issue around access. So the first point here, which is that 40% of countries have no licensed DMTs available. So these are these on-labeled DMTs. And this gets much worse when you're looking at different regions, such as Africa, or you split by income levels. So 70% of low-income countries do not have access to licensed DMTs. As you've seen in terms of the research, there's a lot of interest in terms of high efficacy DMTs. And what we found was that when we narrowed down our search into that, we found that the inequity was even greater when you're looking at high efficacy DMTs. This is again looking at on-label, and we found 25% of countries around the world did not use them. 50% in lower middle income countries, and in fact, 100% of low income countries. On the flip side, we found that a very large proportion, 87% of countries, were reporting use of off-label drugs. And another interesting finding that we had was that 50% of countries actually reported there being issues around the continuation of DMT. So once you started on a DMT, making sure that you're getting it regularly and you can trust that that's going to happen was an issue in half of the countries surveyed. I want to highlight, though, that all of this data also is available as an Excel download on our website, which means that people can do comparisons between different regions, looking at different drugs or any of the other data as well. And actually here is an example of MSIF's work looking at access to disease-modifying therapy, specifically in MENA. I'm now going to talk a little bit more about the essential medicine work, as well as Shanti Viswanathan, who will be talking about the off-label work later on. But before I do that, I wanted to introduce you to our International Working Group on Access. It's a bunch of people here in the photo, and they're in charge of strategy development and also starting and developing the projects. It's 24 members. We cover all of the WHO world regions, and we have people with MS, healthcare professionals, and MS organizations involved. Okay, so essential medicines for MS. So essential medicines are drugs that should be available in all health systems at all times. Basically, they are prioritized drugs. The World Health Organization has a model list of essential medicines. We call it EML. It's updated every 2 years, and at the moment, neurological conditions are not well represented. There are no drugs listed for MS. So what we did back in 2018 and 19 was that we applied for 3 different DMTs to be added onto the list. Here is a screenshot of the World Health Organization website. You can access all the information there. And we also have a scientific publication that outlines the methodology and the logic that we use to choose these 3 different DMTs to put forward. Unfortunately, the expert committee decided that they did not want to list on the WHO EML any of the 3 drugs that we supported. However, they did recognize that MS had a disease burden around the world and that there should be some DMTs listed. They asked us to revise for another application the different DMTs that exist, and also consider the sort of off-label DMTs within our decision-making. Despite us not being able to get these DMTs listed, what it did help us with was that we got a lot of more attention and awareness around the issue around access to treatment in MS. We developed good relationships with the WHO, as well as the neurological organizations, as well as TRIMS. And you can see there's been a couple of nice mentions of our work and publications around essential medicines and MS. So we're back in business. We have now formed a essential medicine panel in 2021, and we plan to submit another application to the WHO EML in 2022. This group will have 2 aims. One is really to provide guidance on what are essential medicines for MS, and the other one is the application to the EML. So how are we going to do this? First of all, it was really important for us to find the right people to work with. There are 17 on-label DMTs available for MS, and there's a number of different ones that are used off-label. This is a large amount of data. So what we have done is that we're collaborating with Cochrane, who are experts in evidence synthesis, and they're reviewing all of the scientific papers and other information available for all of the different DMTs. This information will be presented to the panel for consideration, and we're using something called evidence to decision framework to make the recommendations. And in order to do this very structurally and in an unbiased way, we have been collaborating with the Grade Center at McMaster University. They will facilitate us to go through, or the panel to go through, the 12 different criteria, which are listed here. And I'm not going to go through all of them, but I want to highlight that this approach and framework actually takes into account a little bit more than just the health effects. So it really is thinking also about the implementation. So number 7 here, you can see that they're considering the resource requirements, so the costs. They're also concerned about health equity, as well as acceptability, as well as feasibility. So this is really thinking about, once these drugs are narrowed down to the ones that are considered essential, how well can this be implemented, especially in low resource settings? And just to give you a brief overview of the full process, we've just formed the MEM panel in the last 6 months. The evidence review is ongoing with the Cochrane group. And next year, second quarter, we will have the panel discussions. So they will go through the evidence to decision framework, make some draft recommendations. These draft recommendations would go for consultation. We will produce a EML application, but we also want to make sure that this guidance is available in another format as well. So we're going to be writing also a guideline manuscript, which will be published in a peer-reviewed scientific article. And then depending on what the outcome from the EML is, we will have different activities for dissemination and advocacy. And in addition, we are looking at endorsements for the guideline publication from different organizations so that it will be very effective for advocacy activities. So this brings me to the end of the 3 topics that I'm going to cover today. And we will have Dr. Shanti Viswanathan talking to us about the off-label treatment work that we have been doing. And after that, we will also have 2 case studies, one from Morocco and one from Malaysia, thinking about how do we actually put some of the work that we're doing into action on a national level. Thank you very much.